What is AML? AML, or acute myeloid leukemia, is a type of cancer of the white blood cell. Cancer is defined as the uncontrollable growth of abnormal cells. AML originates in the bone marrow. The bone marrow is the soft inside of bones where new blood cells are made. AML is characterized by the accumulation of abnormal, immature bone marrow cells called blasts. Normal bone marrow contains 1 to 2% of blasts, whereas AML bone marrow contains 20% or more blasts. What does the acute mean in acute myeloid leukemia? The acute refers to the aggressive nature of the cancer, which comes on suddenly and, if not treated, may progress quickly. How common is AML? AML affects 3 to 4 individuals in every 100,000. The average age at diagnosis is 68. What are the symptoms of AML? Common symptoms include fatigue, fever, breathlessness, frequent infections, bleeding, and easy bruising. What are the risk factors for AML? A risk factor is a characteristic that may affect your chance of acquiring a disease. Risk factors for AML include old age, being male, smoking, prior exposure to radiation, previous chemotherapy treatments, and genetics. What are the goals of AML treatment? The goals of treatment are to improve blood counts, achieve remission, improve symptoms, improve quality of life, and occasionally, to cure. Complete remission means that there are less than 5% blasts in the bone marrow and that blood counts have returned to normal levels. Long-term remission, or more than 4 to 5 years of remission, may be considered cure. What are the treatment approaches for AML in older adults? There are 3 general approaches to treating AML in older adults: intensive treatment, lower intensity treatment, and best supportive care. The first approach, intensive treatment, involves undergoing chemotherapy in 2 phases. The goal of the first phase, induction, is to induce a complete remission, or less than 5% blasts in the bone marrow. The induction phase typically requires you to be admitted to the hospital for 4 to 5 weeks straight. The second phase, consolidation, is administered shortly after induction. The purpose of this second phase is to decrease chance of relapse. The consolidation phase may involve chemotherapy, a stem cell transplant, or both. Intensive treatment is potentially curative. What is an allogeneic stem cell transplant? An allogeneic stem cell transplant is a procedure where a patient's own bone marrow stem cells are replaced by healthy stem cells obtained from a donor. It is an intensive procedure performed in the hospital once remission has been achieved, with the goal of increasing the chance of cure. Who is a candidate for a stem cell transplant? Several medical tests need to be completed to determine transplant eligibility. Those without significant medical problems and those able to achieve remission are considered for a stem cell transplant. The second approach to treating AML is lower intensity treatment. This option is for those who may not be able to tolerate the toxicity of the intensive approach, or those who have specific genetic mutations. Lower intensity treatment is generally given in the outpatient setting and may include injections, infusions through a vein, or pills. Lower intensity treatment aims to prolong survival and improve symptoms and quality of life, but is generally not curative without an allogeneic stem cell transplant. The third approach is best supportive care. This approach aims to manage the most serious symptoms of AML and low blood counts with blood transfusions and antibiotics without treating the underlying leukemia. It avoids side effects associated with chemotherapy and may improve symptoms and quality of life. Hospice is considered when blood transfusions no longer provide benefits. What is the outlook after AML treatment? Based on prior studies, less than 20% of older adults survive 2 years or more from their diagnosis. However, individual outcomes are highly variable and dependent on many factors, including the underlying health status, specific type of AML, treatment choice, and whether treatment is working. If you have further questions, please discuss with your healthcare provider.